The mosquito, a tiny and sometimes undetectable flying insect. Its powers are often underestimated. For some people, a mosquito bite is a simple annoyance that swells and goes away in the course of a few days. For others, the power of one mosquito bite delivers a tragic effect felt by the entire community. Oftentimes, it serves as the difference between life and death. According to the UN's International Children's Emergency Fund, commonly referred to as UNICEF, every 2 minutes, a child under 5 dies of malaria. Malaria is a mosquito-borne disease caused by a tiny parasite. And where would you assume the majority of these deaths occur? If you said Africa, you would be correct. To be more precise, the majority of these malaria-related deaths occur in the Sub-Saharan regions of Africa. Topics such as malaria prevention are a top priority for the CSP Foundation. This informational video is intended to enlighten people about the health-related issues our team encounters in the field and how it affects the populations we serve. Here are some of the most common issues that children face in the sub-Saharan regions of Africa, with definitions courtesy of Mayo Clinic, UNICEF, and CDC. IMPETIGO. IMPETIGO is a common and highly contagious skin infection that mainly affects infants and children. IMPETIGO usually appears as red sores on the face, especially around a child's nose and mouth, and on their hands and feet. It is made worse by poor hygiene and warm temperatures. Scabies. Scabies is an itchy skin condition caused by a tiny burrowing mite. Ringworm. Ringworm of the body is a rash caused by a fungal infection. Infant mortality and under 5 mortality rate. The leading causes are malnutrition and low income or socioeconomic statuses. Sudden infant death syndrome, or SIDS, is the unexplained death, usually during sleep, of a seemingly healthy baby. The leading cause is unknown. Diarrhea, the second leading cause of death in children under 5. Meningitis, an inflammation of the membrane surrounding your brain and spinal cord. It affects thousands of children annually. According to the CDC, although meningitis outbreaks can occur anywhere in the world, they are most common in the African meningitis belt, and large-scale epidemics occur every 5 to 12 years. Pneumonia, bacterial infection that inflames the air sacs in one or both of the lungs, causing cough and difficulty breathing. This is one of the leading causes of deaths among children under 5. HIV and AIDS. Transmission is usually spread by contact with infected blood or from mother to child during pregnancy, childbirth, or breastfeeding. Over 2.8 million children and adolescents were living with HIV in 2019, nearly 9 out of 10 in sub-Saharan Africa. Sepsis. Sepsis is a potentially life-threatening condition caused by the body's response to an infection. The body normally releases chemicals into the bloodstream to fight an infection. Sepsis occurs when the body's response to these chemicals is out of balance, triggering changes that can damage multiple organ systems. If sepsis progresses to septic shock, blood pressure drops dramatically. This may lead to death, and this is a common cause of death for children under 1. Parasites. Parasitic infections are caused by a lack of access to good quality drinking water. People become infected with these diseases when they swallow or have contact with the water that has been contaminated by certain parasites. For example, individuals drinking water contaminated with fecal matter. Typhoid. Typhoid fever spreads through contaminated food and water or through close contact with someone who is infected. Signs and symptoms usually include high fever, headache, abdominal pain, and either constipation or diarrhea. The final, and perhaps the greatest impediment to resolving some of these issues, is the lack of access to proper medical care and medications. This is where we strive to provide solutions. With the assistance of our medical team and generous contributors, we host free annual checkup exams for every rural village community that we impact. This is intended to give minimum access to quality healthcare services. We hope that our efforts help to aid in curbing the amount of underage preventable deaths in children. Health is one of our 3 core values, known as our 3 golden hearts, and it is children's health in particular that serves as one of the primary goals of our mission. We know there are people who also share this same value. Therefore, we encourage you to advocate for the rights of children globally. If you or your organization or community would like to help the communities we serve to combat these issues, visit our website at the CSP Foundation.org to find out how you can support.